Where in a bid to enhance Nigeria's readiness for public health emergencies, a citizen-led policy dialogue on health security reforms has called for urgent action on the passage of the Public Health Emergency Bill and the NCDC Amendment Bill to strengthen health security in Nigeria. The Coordinating Minister of Health and Social Welfare, Mohammed Ali Pate, at the event emphasized the importance of a sector-wide approach, SWOT, to unify government agencies, donors, private partners and civil society under a single plan, budget, report and conversation. Our correspondent tells us more.
Health security has become a global priority due to the increasing frequency of infectious disease outbreaks and other health emergencies. Major events including the COVID-19 pandemic, mpox, and recurring outbreaks of Lassa fever, cholera, and Marburg virus underscore the need for resilient health security infrastructure capable of effectively responding to public health threats. This dialogue has become essential to align Nigerians' health security practices with international standards. Stakeholders at the dialogue advocated for key legislative and technical interventions, such as the Public Health Emergency Bill and NCDC Amendment Bill, to secure more financing for health security.
Specifically, we are using the SWOT platform to bring together government agencies, donors, public-private partners, and civil society groups under a uniform platform to achieve national development objective, which is one plan, one budget, one report, and one conversation. More importantly, we're adopting strategies to consolidate resources and actions by replacing project-based fragmented approaches with a unified sector-wide approach that reflects national priorities. To protect citizens and ensure a healthier future, we must invest in robust, adaptable health systems underpinned by sound legal health reforms and transparent health financing.
Representatives including the Special Assistant to the President on Health, Dr. Ahmed Baba, and Sikiru Badaru of the NCDC highlighted the importance of these reforms.
And you can't be talking about a resilient health system without antimicrobial resistance, and then for you to address antimicrobial resistance, you must have a resilient health system. And so this engagement is one in many that we think should go on, because we need to get these bills signed into law. So as soon as they leave the National Assembly, Mr. President is ready to make them assented and then put into law. And then we want them to also be domesticated.
There's supposed to be a robust legislation that will take care of collaborative functions, whereby each sector will know when they should kick in and how to support in terms of funding and in terms of implementation of activities. So this is also need to be looked into in our legislation. These are issues that demands our presence here today, and we really appreciate you. From what the leadership of NCDC has just been mandated to do is to...
While Nigeria has made significant progress in establishing health security infrastructure, such as the Nigerian Center for Disease Control and National Action Plan for Health Security, the Health Sector Reform Coalition noted that gaps in coordination and financing still remain.
We resolve as follows: that the Health Sector Reform Coalition, Federal Ministry of Health, NCDC, and development partners to advocate for and facilitate the passage of critical health security legislation and improve financing through champions within the National Assembly. Stakeholders are encouraged to adopt the Health Security Accountability Framework to enhance civil society advocacy and accountability, thereby strengthening health security in Nigeria. The Health Sector Reform Coalition will follow up with relevant stakeholders to ensure institutional adoption of this framework.
The accountability framework was developed to track health security financing in the country. We want a situation where there is efficient funding to run various health security activities as needed. And this goes beyond just response activities when there is an outbreak. We also want to see funding set aside for prevention and also detection of public health threats or diseases as it may be.
Stakeholders also emphasized the need for reforms that could enhance accountability, improve transparency in health, security funding, and boost Nigerians' performance in the next external evaluation.